Good afternoon and welcome to the City of Toronto's COVID-19 media briefing for Wednesday, April the 28th, 2021. Joining us today is Toronto Mayor John Tory, Toronto's Medical Officer of Health, Dr. Eileen, and Toronto Fire Chief and the General Manager of the Office of Emergency Management, Matthew Pegg. Mayor Tory?
Well, Brad, thank you and good afternoon. To update, more than 1,104,855 doses of COVID-19 vaccine have now been administered by Team Toronto within the City of Toronto. And Team Toronto, of course, includes our hospital partners, healthcare partners, city staff, and Toronto Public Health. And more people are becoming eligible to get vaccinated. In cooperation with the province, we've now lowered the eligibility age in our city-run clinics to 45 or older for people who live in the 53 identified hotspots, which you can see at toronto.ca/COVID-19. Starting tomorrow, childcare workers in licensed childcare settings will also be eligible to book an appointment at a city-operated clinic through the Provincial Booking Call Centre at 1-833-943-3900. As this month comes to an end, we know that next month will bring a lot more vaccine doses, and we will run in a situation out of the valley that we're currently in. This will allow us to ramp up the capacity we have in Team Toronto. We've had that capacity in place for some time to get more shots in more arms. All we needed was more supply. To all the people who are eager to get vaccinated but not yet eligible, please know that day will come soon as supply increases and we are able to get through the initial groups established by the province. This morning, we announced that the City is partnering with Vaccine Hunters Canada to assist Toronto residents in identifying available next-day appointments at the city-run immunization clinics. Getting everyone vaccinated is a huge, all-hands-on-deck effort, and Vaccine Hunters have stepped up to help people get vaccinated and to navigate the different registration systems. I want to thank Councillor Cressy and City staff for working with Vaccine Hunters to find a way we can share information on available appointments in city-run clinics. It is a volunteer organization, Vaccine Hunters that is doing great work. They're exactly the type of group an innovative government and city should partner with to benefit our residents. We're excited to work with Vaccine Hunters to help get more people vaccinated. Last year, in the midst of the first wave of COVID-19, I asked our Senior Services and Long-Term Care Division to report on the actions taken to protect the residents of the city's 10 long-term care homes and what action was needed to be taken right away to further protect residents and our workers from the pandemic. They prepared a very complete report in response, which was made public. Now we have a new follow-up report, which I also requested, and we are making it public today. The second report summarizes the actions that the city government has taken to protect the health and safety and well-being of the 2,600 plus residents and the 3,300 plus staff in city-operated long-term care residences during the second wave of the COVID-19 pandemic. In delivering the report, Senior Services General Manager Paul Raftis also confirmed that although our city long-term care residences have faced challenges, as of April 7th, 2021, 97% of long-term care residents in our care, 81% of staff members, and 77% of essential caregivers have been vaccinated. And we are continuing to plan for the new normal in the city's 10 directly operated long-term care residences. The long-term care sector as a whole has experienced extreme challenges and tragedy throughout this pandemic. And while they generally met these challenges fairly well, the city's 10 directly operated residents were not immune. The difference, however, is how the city managed the crisis by collaborating with colleagues throughout the Toronto Public Service, building strong relationships with health system partners to care for our residents. While every resident death is a tragic loss and a single death is one too many, the report notes that the city's long-term care homes have fared better in the second wave relative to the first wave, with fewer cases in our homes and less loss of life. Senior Services has continued with enhanced efforts following the first wave of the pandemic, which included increasing staffing capacity, infection, protection and control training, enhanced cleaning and PPE use, and the creation of isolation rooms in all resident home areas so as to significantly improve outcomes for residents during the pandemic's later stages after the first one. We know from our experience over the last year that proactive testing, enhanced screening, including rapid testing, and vaccine prioritization for long-term care residents, essential caregivers, and staff members have worked together to lower positivity rates and result in fewer COVID-19 deaths in city directly operated long-term care residences, the 10 of them. Today, city long-term care residences are planning for the new normal, in line with all ministry visiting and public health restrictions. I mentioned that this report being made public today is an update report, building on a June 2020 report which included 16 high-impact recommendations to improve emergency and resident care in the city's long-term care residences. 14 of these recommendations have been fully implemented, with the remaining 2 well in hand. This followed my intention in asking for these reports, which was not to wait until the pandemic is over, but to identify and implement changes that were needed as soon as possible. This report includes 9 further internal recommendations, including the establishment of isolation rooms in all resident home areas with shared rooms, and continuing to monitor infection prevention and control measures, training, auditing, and sharing performance results with staff. We will work to make sure these new recommendations are implemented. The report is clear that our long-term care homes worked quickly to protect residents as the second wave struck. It states, and I quote, "By rapidly mobilizing all available resources to implement robust staffing supports, enhanced infection control and testing measures, resident and family support, communications, and most recently a smooth and efficient vaccine rollout, Senior Services has had success responding to the uncertain and evolving nature of the pandemic while prioritizing the safety and well-being of staff and residents," close quote. It also notes that protecting our long-term care residences came with a financial cost. Operating expenses were $32 million higher than planned. The majority of these costs were offset by provincial funding we worked to secure, although there were additional city funds involved as well. Regardless of where the funds came from, these were investments which simply had to be made, as seen from any perspective whatsoever. These are senior residents, some of our most vulnerable residents in this city who were in our care, and we had to make these investments to ensure that they were properly cared for. These investments provided for enhanced staffing levels, purchasing additional PPE, and enhanced cleaning protocols, among other things. And it shows the importance of moving quickly and working together to make those investments. And I can assure people out there, the many families and others who are concerned with this report, the second one that's being made public today, will not be the last one. I know as we face the third wave right now, staff will report back, as I have requested, on additional lessons learned in combating this wave and combating the variants of concern. I want to thank all of the residents in our long-term care homes who have been vaccinated to protect themselves, as well as their fellow residents, their families, and our staff members who have done so as well. And I want to be clear that we, your City of Toronto government, remain absolutely committed to making sure that the city's long-term care residences continue to lead the way in responding to the pandemic and at all times, pandemic or not, keeping the residents safe and well cared for. We know at some point we'll be able to reopen again, and we want to make sure that we are doing everything as a city to help businesses when they can safely welcome customers once again. Following very careful consideration of the impacts that the pandemic has had on the restaurant and bar industry in particular, and in consultation with Toronto Public Health, I'm confirming today that the installation of the Cafe TO locations in curb lanes will begin as planned starting on May the 8th. That work will take about 3 weeks to complete in all of the various neighborhoods, and we didn't want to wait until public health measures had changed. We want to be ready. This will ensure that when public health orders permit, restaurant and bar operators will be ready to maximize the patio season, and there will be no delay in getting the Cafe TO installations up and running. As long as outdoor dining is prohibited in Toronto, cafe operators will be required to ensure that these curb lane closure areas are not used for congregation or for public seating or for dining purposes. I know they would rather have the Cafe TO infrastructure there and ready to go than to wait, even though they can't use it right now. This will ensure that as soon as it is safe to do so, restaurant and bar operators will have this expanded space immediately available to them to help customers and employees keep physical distance and, of course, to generate revenue they desperately need as a result of the long winter that they've experienced. Our restaurants continue to sacrifice a great deal in order to follow the necessary and effective life-saving measures that have been put into place to keep our families and our neighbors and our communities safe. There is tremendous demand for the second year of Cafe TO because a lot of them need the additional revenue opportunity to recover. I can tell you that from just the first registration window, city staff are reviewing 720 curb lane cafes and 71 public partlets for expanded dining space. Already, more than 311 sidewalk cafes are already approved citywide. I know it's exciting to think about outdoor dining again. The fastest way we can get to that day when we can enjoy a meal and a drink on a patio at our favorite restaurant or bar is to follow public health advice right now. We need to stop the spread of COVID-19 now. The best way we can help our restaurants and other businesses, our friends and our neighbors, yes, is to shop local and do takeout and things like that, but to support these people in the best way we can, whose livelihoods depend on a safe reopening, and is by everyone working hard now to follow public health guidance and to get vaccinated as soon as possible. We do know, and this is an encouraging thing, that citywide traffic volumes marginally decreased last week as new restrictions were added to the existing stay-at-home order. City staff saw a more than noticeable drop in citywide congestion, which is now comparable, the congestion levels are, to conditions during the lockdown earlier this year prior to the reopening of schools. So this all will make a difference, but it will take time. We will start to see a difference in the case numbers and in some of the rates of hospitalization and admittance to the ICU, but things need to go in the right direction. And I want to say thank you for the things you are doing now to help start to make that happen. Doing the right thing, following the public health advice, it will help us to get through this. I'd now like to ask Dr. Davila to present her report for today.
Thank you, Mayor Tory, and good afternoon. Today, I am reporting 1,055 new cases of COVID-19. 1,121 people are in the hospital. 242 people are in the ICU. And I'm saddened to report 13 deaths today. Yesterday, I read some figures from Our World in Data, a research and data analysis center partnered with the University of Oxford. It listed Canada as having 30% of the population with at least one dose of vaccine. Only 8 other countries in the world were ahead of us, and 3 of those are the United Kingdom, the United States, and Israel, whose vaccination progress is the envy of the world. Here in Toronto, we are seeing success in targeting the vaccine where it will produce the most effect under the current circumstances. It sometimes feels contradictory to speak to our success in the delivery of vaccinations when there are still so many waiting their turn, and while the third wave is still so dangerous. That danger is why the approach we are taking makes the most effective use of the vaccine supply at our disposal. Toronto Public Health, our hospital partners, and our community partners are all collaborating to deliver the doses we have to best advantage. We are confident that the current hotspot strategy delivers a double advantage. The strategy not only targets the neighborhoods and demographics that are at greatest risk of infection, but also indirectly reaches into workplaces where it can be easy for COVID-19 to spread, as we know these neighborhoods are often home to essential and frontline workers. In addition to the hotspot strategy, our hospital partners have conducted 2 pilot workplace vaccination campaigns in Toronto. We are actively working with our vaccination partners to review these pilots, and together we'll make decisions on next steps when we have more vaccine supply. While we often speak of neighborhoods at greatest risk, we are well aware these are not the only places facing risk. Everyone in Toronto has shared fear, disruption, and risk from COVID-19, even if we often experience these things in different ways. As a matter of public health, we need and want everyone in Toronto, wherever you live, to be vaccinated against COVID-19. There is almost nowhere in the world that does not share the same need that we have to acquire sufficient vaccine. We are now seeing that there are places in the world where the vaccines have been so extensively delivered that the signs of their power over COVID-19 are clear and reassuring. In the United Kingdom, the government is proceeding cautiously towards more normal life after months of intense restrictions and intense vaccination. Almost 65% of Britons 18 years of age and older have received a first vaccination. Yet at the same time, the government is under political and popular pressure to move faster and to reduce restrictions sooner. This impatience, while understandable, may result in serious consequences. All eyes will be on the UK as it moves ahead to observe which path it follows and what follows from the path it chooses. The same is true of the United States. In the US, the Centers for Disease Control and Prevention has published information about what vaccinated people can do now, including yesterday's announcement that fully vaccinated people don't need to wear masks outdoors, except in crowded settings. Still, the emerging flexibility in American daily life is modest in many states. At the same time, variants, aggressive relaxing of public health measures, and COVID fatigue are factors in a noticeable resurgence in some states and amongst young people who haven't yet had access to vaccine. There are lessons in the experiences of those who are ahead of us in the long march toward a more usual way of living. Each step we take as individuals during this stay-at-home order will determine whether we will outpace the risk of COVID-19 or if COVID-19 will outpace us. This is in effect like walking a tightrope. A tightrope walker was quoted as saying that the most dangerous part of the walk was when you have to turn, because that is the only moment when you take your eyes off where you're heading, and that's when you really risk falling. If we lose sight of where we are, we could wind up back where we started again. The cautions I raise are to say, always remember that however difficult and unpredictable and frustrating the path can be at points, we are moving in the right direction. And never forget that as we move in that direction, we have to keep focus on the risk of spread until everyone has reached safety. I'll now turn it over to Chief Pegg to deliver his remarks.
Thank you, Dr. Davila, and good afternoon. The eligibility for booking vaccine appointments is determined by the Province of Ontario. Effective 8 a.m. yesterday morning, the province extended vaccine eligibility to those 45 years of age and older who live in hotspot areas. Further, beginning tomorrow morning at 8 a.m., child care workers in licensed child care settings are also eligible to book their appointment for COVID-19 vaccine in any of the city-operated vaccine clinics. Over the course of this week, we are able to vaccinate approximately 46,000 people across our network of city-operated clinics. I'm pleased to report that 10,651 people successfully booked their appointments for vaccine in a city-operated clinic on Monday. Another 21,046 people booked yesterday, and as of 1:45 this afternoon, a further 4,914 people have booked today. As of this morning, there were a few vaccine appointments available for the remainder of this week, and there are still appointments available to be booked during the weeks of May 3rd and May 10th. To summarize, the following groups of people are eligible to book their appointment for COVID-19 vaccine in a city-operated clinic. Anyone who is 60 years of age or older, anyone 45 years of age or older who lives in one of the identified hotspot neighborhoods, anyone who is pregnant, any elementary or secondary education workers who work in a COVID-19 hotspot in Toronto, any elementary or secondary education workers who support students with special education needs, any elementary or secondary education workers who live in a Toronto hotspot, and beginning tomorrow morning, any childcare workers who work in licensed childcare settings. Residents who are 60 years of age and older, along with residents who are 45 years of age and older and who live in one of the identified hotspot neighborhoods, are able to book their appointment via the Provincial online booking system. Those who are pregnant, education workers, and beginning tomorrow, childcare workers, are able to book their appointments by calling the Provincial call center at 1-833-943-3900. The number of appointments that are made available in city-operated vaccine clinics correspond directly with the number of doses of vaccine that are available to be administered. As vaccine availability begins to increase moving forward, we are both able and ready to expand our clinic operations to match. In closing, I would like to address one important question that has been raised of late. Regardless of where you receive your vaccine, and regardless of which vaccine you receive, there are no costs or fees that you are required to pay. Receiving your COVID-19 vaccine is free for everyone, including receiving your vaccine in a pharmacy or any clinic location. Thank you for all that you do to help stop the spread of COVID-19 in our city. Please continue to monitor toronto.ca/COVID-19 for the most up-to-date information on immunization in Toronto. Thank you.
Thank you very much, Chief. We'll now go to questions. Just a reminder to please unmute yourself. We'll go first to Brian Passafume from the Toronto Sun. Brian, go ahead, please.
Hey, good afternoon, everybody. It's a quick question in regards to the Vaccine Hunters partnership. I'm curious as to why the decision was made to frame this as a partnership. When all it seems the city is doing is providing a third-party information on next-day appointments, vaccine appointments, and essentially not paying a group of volunteers to advertise city-run clinics. A lot of people, myself included, owe a debt of gratitude to Vaccine Hunters Canada for the great work they do in helping people navigate what I think we can all agree has been a pretty confusing vaccination rollout. My question is, putting all the spin aside for the moment, is there some sort of sense of embarrassment that this group of volunteers has managed to succeed at something that the city has so far had a bit of a hard time figuring out?
I'll start with that and just say that what there is a great sense of pride in the fact that people would come forward as volunteers, would develop an app that can be so useful to people, and can add to our overall and overriding desire, which is to make it as easy as we can in a complex set of circumstances, not all of them determined by us, about who can get vaccinated and when. I mean, I admit that for people keeping up with all these different rules that are put in place by the province and different clinics operated by ourselves, by the hospitals and others, has been daunting for people to deal with. But our objective, and we've had all kinds of partnerships, and we call them that because that's what they are, people working together in a common cause to get people vaccinated and make it as easy as possible. And I take great pride in the fact that these people are out there, and great pride in the fact that Chief Pegg and the city organization said, let's make sure we work as closely together as possible. So all it involves is us giving them a roster of available appointments and them making those through their channel known to people, which in turn hopefully makes it easier for people to hook up. To me, this is an entirely good news story. There's not a bad news aspect to it.
Okay. A second question in regards to Councillor Matlow's proposal to prevent drinking in parks that the Economic Committee sent into limbo yesterday. I'd like the mayor's stance on this, specifically allowing drinking in parks, and how you reacted to the councillor's argument of equity, as he mentioned, only a privileged few in Toronto actually have access to backyards, patios, and balconies.
Well, I will just say this. I've been on the record for some time as being favorably disposed to taking a look at these laws so as to consider the notion of people having a glass of wine or a can of beer when they're visiting a park. And people are doing this in any event. But right now, we're entirely focused on hospitals that are full because of a terrible pandemic that is overcoming the city. And I think it is something that we will, I'm sure, take a look at in the right way at the right time, and that we'll be doing it in a way that makes sense. But I would point something out that I think is very interesting. In a city of 3 million people, in a year last year which had heavy use of the parks, and there are 1,500 parks across the city, there was the grand total of 69 tickets issued last year in respect of people having a drink in a park. And my guess is that the vast majority of those 69 tickets were not issued to people who were having a glass of wine or a can of beer. So I think that we'll get on to this, and we will deal with it, and we will go forward with public consultation and consultation with our medical and public health experts. But it is one of those things where I think we have our hands full right now just dealing with the things we're dealing with.
All right, thank you. We'll go next to Mark McAllister from City News. Mark, go ahead, please.
Thank you very much. A question for perhaps Chief Pegg to start, but if Dr. Davila or Mayor Tory, if you would like to address it, please do. I guess as the main champion for Team Toronto, the partnership with hospitals and healthcare partners, I wouldn't mind asking you to speak to some more confusion. A flyer was sent out in the M3H hotspot area close to Earl Bales Park, prioritizing specific buildings. Then there was a note from North York General on Twitter opening things up to the rest of the postal code to go get a registration card, then to return for an appointment the next day. There are people arguing that that works against those who are disadvantaged and the people that were told that their building was considered a priority. How is this sufficient, or does it cause more confusion yet again?
Hi, good afternoon, Mark. So I'll start by saying I have acknowledged, and all of us have collectively acknowledged, that the rollout and administration of vaccine is very challenging. It is a complicated and complex thing to manage in a city the size of Toronto. But I will say that, having said all of that, by and large, from my perspective, that effort has gone well and continues to go well. We, as you know, the City of Toronto operates a network of 9 clinics. Those clinics are all registered solely through the provincial booking system, and that is a decision that we made in partnership with the province going all the way back into January when we were asked to stand up the original proof of concept clinic. Our many community partners, including the Ontario Health teams and hospital partners, each now, with I'm proud to say, an expanding network of these clinics, each are operating clinics every day across the city, and each of them are informing the decision that they make with respect to how those clinics are advertised and how those clinics are booked on the basis of the feedback that they receive from the specific neighborhoods and from the community partners who are boots on the ground in those specific locations, who are informing the hospital partners and the OHTs with respect to what they believe will work the best. There is no single answer. There is no single process that is used, because frankly there is no one solution that meets the needs of everyone across the community. So you have heard me say before, I'm happy to say again, I certainly acknowledge that keeping track of this and staying on top of all of the vaccine rollout across the various networks can certainly be a challenge. I am very appreciative of the patience that everyone continues to demonstrate as this rollout happens. I can assure you that our teams are working nonstop every day, both from an operational and incident management perspective, as well as our consolidated communications tables, who are working together to provide the most accurate information that we can every single day. But this is a complicated and complex challenge. So I will just say that I appreciate all of the work that's happening in all of the clinics across the city. The end result is what matters the most, and that is as many people as possible are being vaccinated against COVID-19 in as rapid a means as possible in the order that is based primarily on public health advice and based solely on public health advice with respect to the most needy and the highest pressing locations first. Dr. DeVille or Mayor Tory may wish to add.
Yeah, thanks, Chief. I think the only thing I would add is that, a vaccine campaign of this scale and scope has never been undertaken before in the history of this city, this province, or this country. I expect that there may be learnings along the way and little bumps given the size and complexity of the challenge in front of us. But it's been my observation in working with our vaccination partners that they are seeking to learn and improve with each and every clinic as they move forward. And thus far, I think there have been many successes, as there have been, little stumbles and some roadblocks encountered along the way. There have also been many successes, and we're seeing that in the numbers of people that are actually successfully getting vaccinated. And in particular, I'm very pleased to see that neighborhoods that have had the greatest risk and have had the greatest amount of transmission and hospitalization and impact of COVID-19 are now, as a result of the efforts and the strategies that we've put together as vaccine partners, really starting to see increases in the coverage rate in some of the hardest hit neighborhoods in the city.
When following up on these little bumps, as you put it, the conversations that are taking place with your healthcare partners, how do you go about assessing the difficulties and the issues at play, such as the case with the example I brought up about a building being prioritized and then finding out that the entire neighborhood around it was getting access before they do? How is it that you take that information, work it out so it won't happen again?
Well, if I can, Mark, I think that the way that that's done is with honesty and candor, and that's certainly how we've conducted ourselves at the table with our vaccination partners. If we have heard of challenges or heard feedback that it needs to come towards our vaccination partners, we bring it forward and we actually have open and honest conversation. Because if there's one thing that I can say, there isn't a single member at that table, of vaccination partners that isn't interested in doing the very best we can to get as many vaccines into arms in concert with that prioritization framework. We want to do this safely, we want to do it efficiently, and we want to do it as quickly as possible because we want the entire city to be able to experience the protective benefit of vaccines.
Right, thank you. We'll go next to Dave Woodard from Global News Radio 640. Dave, go ahead, please.
Yes, good afternoon. My first question is for Mayor Tory and maybe Dr. Davila as well about the Vaccine Hunter Partnership. What does it say to you about Ontario's vaccine rollout that we have to rely on unpaid volunteers to get the information out?
See, I don't accept the premise of the question. What I would say our mandate is here collectively is to use every single channel, every single resource, every volunteer, every set of legs and eyes and ears and brains that we can to get as many people vaccinated as quickly as possible and to make it as easy as possible for them. And so if some enterprising people, volunteers, God bless them, put together an app like this that people started to use and providing information about how you can get vaccinated and we can help them a little bit, let's look at it that way. We can help them do what they're trying to do, which happens to be exactly the same thing we're trying to do by giving them information on vacant appointments, and they in turn can make that available through their channel in addition to all the efforts we're making to get that information out. That's exactly what we should be doing, and that's exactly, I say respectfully, what they should be doing, and they were doing voluntarily. And again, I'm proud of the fact that we're working together to do that because it's all hands on deck here. This is a team effort, and if we work together with people like Vaccine Hunters and many, many others, we'll get more done, get more people vaccinated, and get this nightmare over with.
Yeah, the follow-up is for Dr. Davila. We're hearing more anecdotal stories now about people going across the border to get vaccinated because it's a faster turnaround time or they can get a second dose quicker. We've also heard that some medical experts might be recommending this in some cases so it can open up more spots here. Dr. Davila, where do you stand on people going south to get vaccinated to open up spots here in Canada?
So thanks for the question. And I can appreciate that some people might see this as an opportunity to help free up spots. That's the implication I think that is being made there. But I would say this. There is currently a stay-at-home order in place. And we are encouraging people to abide by that stay-at-home order to the greatest extent possible. We know that the more we move around, the more we have that opportunity to interact with other people, frankly, the more we contribute to COVID-19 spread. Vaccine is coming in, and as you've heard, we are doing our very best with our vaccination partners to use the resources we have available to us to the greatest effect. Right? Focusing on those neighborhoods in concert with the science where we know transmission is greatest and where the benefit of providing that vaccine up front is the greatest, not just for those neighborhoods, but for the city writ large. So I would encourage people, absolutely, when your turn comes up, please go access vaccine as quickly as possible. There are many channels through which vaccine is available. The chief spoke to them in his remarks. And know that the vaccine partners here are working their very best. They're working their hardest to make sure that we're getting those vaccines out to people as quickly as possible. And in the meantime, I would ask that people continue to really abide by those self-protection measures you've heard me speak about for so many months now, because those continue to be mainstays of protection as well.
Thank you. We'll go next to Natalie Johnson from CTV News. Natalie, go ahead, please.
Hi, everyone. I just wanted to follow up on the vaccine hunters question. I know Mayor Tory just spoke to this, but I'd like to ask Chief Pegg for his thoughts on this, since the chief was a proponent of the city using the provincial booking system, I think, to give the process some uniformity. I know the city is touting this partnership as a win, but don't you think that the very fact that this third-party volunteer resource became so popular in the first place speaks to a communications failure by the government on how people can get their vaccines? There's numerous booking systems within the GTA that don't talk to each other. People are on numerous waiting lists and in many cases don't even know if that means that they'll get an appointment. And so they turned to vaccine hunters for distilled or aggregate information to help them make sense of all of these complex parallel systems.
Hi, good afternoon, Natalie. I'll be very candid. I think that the work that the Vaccine Hunters Canada folks are doing is indicative of the power of reach of social media. And we have seen, certainly have seen throughout COVID and obviously before and in other issues as well, but social media has played an important role in our ability, our collective ability to communicate with one another during the response to COVID-19 and during the ongoing vaccination efforts. The fact that this group of volunteers have come together to commit their expertise and their time and effort to a cause as good as this, quite frankly, warms my heart. And, you know, when you think about I'll speak for me, when I engage in social media and when all of us are subjected to oftentimes what amounts to be so much negativity in that world and in that environment, the fact that these good folks are partnering with the City of Toronto and countless others to be a ray of hope and to provide some positive help, I think that is one of the things that makes me very proud to live in this province and to live in this country. And it is one of the things that causes me to stand up and applaud all of their great work. And that's exactly what I do. They're doing good work for the right reasons, and for the sole purpose of helping people access available vaccines in the fastest amount of time. And my hat is off to them all.
Do you wish then, Chief, that as part of the provincial portal, there was just one pre-registration system in place where everyone just put their name on one master list and then would be notified directly about when and how to book as they became eligible? Well,
when I think back to, as I said earlier, back in the early part of the year in January, when the province of Ontario asked the City of Toronto to stand up the first proof of concept clinic, which was at the Metro Toronto Convention Centre, part of that operation was for us to also evaluate and test the then under development provincial booking system. I will say that booking system for what it is intended to do, works extremely well. The online portal, the portal that people access online for the purposes of going on and accessing available appointments and booking them, is intuitive. It is continuously being reported to me as being intuitive, being seamless, being easy to navigate, and has and continues to work, I would say, nearly flawlessly. When I think about how daunting a task that is, trying to manage the process, even if you just think about the City of Toronto, where our population exceeds that of many provinces, when you think about how big a task that is and what a robust engine is required to run that, I think the province has done an admirable job in moving that forward and getting it up and running. I'm sure history, we will all look back and there will be all kinds of things that we wish were the case. Frankly, my wish is that none of us even knew what COVID-19 is. But that is our reality. We have worked at the speed of COVID to respond, to put robust tools in place to the very best of our collective ability, and to operate them, manage them, and communicate them in accordance with the information we have available in as timely, open, honest, and transparent a means as possible. That's where we've been, it's where we are today, it's where we'll continue to be. I'm sure when this is all over and it's all said and done, we'll be able to look back and learn lessons from that. That's part of any after-action review, and I have every confidence that our city will undertake those processes. I'm sure that others will as well, and I'm sure there will be lessons learned. But as it stands right now, the provincial booking system is serving us well. It was the right decision for the City of Toronto to be a client of that service. And I commend the province of Ontario and their technology team for the system that they have built and for continuing to operate it in a means that has been nothing less than reliable.
Thank you, Chief. We'll go next to Mark Douglas from 680 News. Mark?
Thank you, Brad. I don't want to spend much more time on this topic with the Vaccine Hunters Canada, but a follow-up question again to Mayor Tory and Chief Pegg. Just again to follow up on your very high praise, and I think warranted praise, for Vaccine Hunters Canada and its use of social media. I just want to know, do you believe the city can learn anything specific from the way that group is gathering and sharing information to the public? And I am wondering here about specifics, something you've seen Vaccine Hunters do that you think, oh, we should be doing that at the city.
I'm not enough of an expert to sort of know on what works best on social media. What I do know is that oftentimes it's not government or even big companies that come up with kind of innovative ways to get people's attention, that little twist that causes people to think that it's the place to go. I think a lot of it sometimes just has to do with the sort of viral spread of the name of the website or the Twitter address or the application that catches people's attention, and then one thing leads to another. I will just say this, I think our job nowadays, in government especially, and I think the same is true in business, and that's from a previous life in my case, but in government, our job isn't to be all things to all people and be the people that have the very best of every single website. We're going to try to do that, but if there's somebody out there that can supplement our efforts and make sure that we can get more information to more people to make it easier for more of them to get vaccinated, then, you know, and we often talk here about the fact that sometimes it can be two Ryerson students or two U of T students sitting in a room developing something that is going to be better than we could have a squad of people to come up with in the very best of our companies or in the very best of our governments or anywhere else. And that's the joy of being Canadian, is that we have people with good ideas, we have people who volunteer to step forward, and they help out in what is one of the most important causes we've ever been involved in our lifetimes. And so, to me, I'm sure we'll learn lessons from it when we go back and analyze what did Vaccine Hunters do to start off and catch fire in such a way, and what could we do then to make sure our efforts either later this time or next time are mirroring that. But you know what? By the time we even have that discussion, somebody else will have come along with something better, and that's the joy of being in this country with all the smart people. And the task I think we have is to take advantage of that and partner with those people, as we're doing, so that the ultimate beneficiaries are the people who are going to get vaccinated.
Mark, it's Chief Pegg. Perhaps all I can add is that undoubtedly one of the keys to effective social media is to amass a following, if you will, or a set of followers that are aligned and are following that particular channel for that particular reason. I think Vaccine Hunters has done a fantastic job at aligning people and at engaging people from an interest perspective and getting them to follow and engage and sharing information. And yeah, there undoubtedly will be lessons learned there, as the mayor just said. I think it just really speaks to the often overwhelming power of social media, and this is smart, dedicated, passionate people who are bringing their expertise and their knowledge of social media and using it for the power of good, understanding that just in the same way as negative information can spread quickly, so can positive information spread quickly when used effectively on social media, and they're leveraging that machine, and I commend them for that.
Thanks very much. I'm running out of time in my day. I'll have to pass on a follow-up question there. Thanks very much for your time.
Thank you, Mark. We'll go next to Shauna Hunt from City News. Go ahead, Shauna.
Hi, good afternoon. This question is for Dr. Davila. So a handful of private schools in the Bathurst and Lawrence area remain open every day. One school in particular, hundreds of students and staff are in the building. That's on top of a sizable daycare that runs out of the building. It really looks like a typical school day. At another school down the street, we've seen students loading onto a yellow school bus. So the school officials are saying that they're not doing in-person learning, but instead they're holding religious services. I know that the provincial regulations state that, in places of worship, the limit is 10. The school officials, though, are saying that they're holding multiple services at a time, keeping 10 people to a room, and they claim that that's, within the regulations. But again, this is happening 5 hours a day, 5 days a week. It's a school full of hundreds of people. I know that public health is investigating this and is aware of it, and I believe that public health has been investigating for a couple of weeks now. Residents from the neighborhood, several of them, are reaching out to us, and they see this as, a big public health concern, and they're wondering why these schools are allowed to operate and why they haven't been shut down.
So Shauna, thanks for raising the issue. You're quite right. This is something that we are aware of, and it's something in which public health staff, amongst others, are involved in investigating. And I think that in order to be fair and appropriate, it's important to let investigators conduct their investigation appropriately and then work with those who have expertise in enforcement and in assessment to determine what the next most appropriate steps are. I appreciate that there are concerns that you've indicated are being raised by neighbors or members of the community, but there's what it might appear to be or what people may think is happening. And then there's what is actually happening, and we can never tell what that is until you actually do the investigation, do a proper assessment, and then take reasonable steps to manage any public health risks that might exist. So that's exactly what the staff at Toronto Public Health have done throughout the course of the pandemic, whether it's in respect of this particular situation or any other. And I think you can count on us to continue to do that work and to do fair and appropriate assessments, seeking to limit or mitigate any public health risk where it exists in our community.
Okay, just a quick follow-up. It's just the investigation's been underway for a while now, and if you go at 9 o'clock in the morning or 2 o'clock in the afternoon, it's easy to see just the amount of people that are congregating in this building. So can you clarify for me then the regulations surrounding places of worship? The regulation is a limit of 10 people. Is that 10 people in a facility at a time, or can any, synagogue or mosque or church have 10 people in multiple rooms holding multiple services at a time? Is this regulation, can it be interpreted in different ways?
So Shauna, I think in my experience, different people tend to have different interpretations of existing legislation. I think that's what keeps our lawyers so busy. They do, read the legislation, and again, different people have different interpretations. At this point in time, with respect to the situation you're describing, we're going to continue our assessment and take action in keeping with the public health risk and in accordance with the legislation. We do this with both a public health perspective in mind, but of course we have to consult with legal counsel to ensure that we are adopting a reasonable interpretation of the legislation such as it exists.
Thank you. We'll go next to Mike Walker from CTV News. Mike, go ahead, please.
Good afternoon. Thank you for taking my questions. Just following up on the Cafe TO announcement, and sorry if I missed this earlier. Just want to confirm why we're moving ahead with these installations on May 8th when the stay-at-home order is still in effect. And no doubt some restaurant owners we spoke with are pretty optimistic about this, but also don't want to get a sense of false hope. So what do you say to them when there's still no guarantees at this point?
I think the vast majority of the restaurateurs and bar owners who have suffered so terribly during this pandemic would heartily endorse what we're doing, which is to make sure we put the installations in place, which really are about public safety and carving out those spaces in curb lanes, and get them in now. So that the day that Dr. Davila and the province of Ontario give the green light to allowing outdoor dining, we're ready to go, as opposed to a situation where we might get that green light sometime down the road and then take the time for a couple of weeks to put these installations in. It takes time to do this. We are doing this so that the minute we get the green light, the minute they get the green light to be back in business and serving customers, they have the opportunity to take in the extra revenue and the opportunity, frankly, for customers to enjoy these patios they enjoyed so much, as opposed to waiting around until we know that the restrictions are lifted. I think it's the smart thing for us to do, and I think it's going to benefit those businesses in the end.
And just a follow up, and Dr. Davila, maybe you can speak to this as well. How realistic is that initial May long weekend target date to see these patios reopen? And even if the stay-at-home order is lifted by then, what would you like to see in terms of with the cases where we would be comfortable with outdoor dining resuming?
So I think any ability to move forward and restore activities more like they were before there was a COVID-19 really does rest in our hands. You've heard me say this before. To the extent that we are able, all of us, to abide by the terms of the stay-at-home order now and to minimize interaction with other people, because we know that that's how COVID-19 spreads. So the more we're able to limit our interactions with others, particularly those with whom we do not live, the sooner we will get COVID-19 behind us. This, at the same time, as vaccines are being deployed and administered all around the city, I would just add that for everyone to be able to get their vaccine or to seek out that vaccine as soon as their turn comes up, as soon as they hear about their eligibility. When we put these actions together, that's what will get us to the other side of this pandemic sooner rather than later. Of course, I've mentioned in my remarks today that we're seeing in other jurisdictions those who are a little ahead of us in respect of their pandemic experience and those who have a little bit more by way of vaccinated population. We're actively watching them and learning to see how soon might we be able to proceed safely with certain activities. And you've heard me say before that activities that take place in the outdoors, in big open air spaces, are certainly safer. So I think it's wise to be ready, wise to be proactive about this, and of course in the meantime to be very vigilant around self-protection behaviors and getting vaccine as soon as your turn comes up. This is the best we can all do to get us to the other side of this pandemic.
Thank you. Final question.
Just
Oh,
one
I'm sorry,
thing.
Mr. Mayor.
To look at this a different way, if we don't keep our distance and follow the public health rules, if we don't get vaccinated in increasing numbers, and I think the supply is going to allow us to do that, and we've certainly got the capacity to deliver, and if we don't put these installations in now, then it'll substantially reduce the chances we'll be sitting on any patios around that time in later May. So I think we're just trying to encourage everybody to do all the things that they can do, follow the public health rules, get vaccinated, and we're going to help with that. And then we're going to get these installations in so that, if we do all those things, we'll be in a position to start to enjoy life a little bit again when the time comes.
Thank you, Mayor Tory. Final question then is to Samantha Beattie from CBC News. Samantha, go ahead, please.
The city has said enforcement of bylaws in city parks won't happen in April. Our understanding is that the Pathway Inside program is ongoing, and the shelter where it is at 45 the Esplanade is reopening this week after it was closed because of a COVID outbreak. Are you planning to clear these encampments in May?
I was involved in a meeting with our officials this morning about this, and of course there's been extensive consultation going on and discussion with the city councillors involved in some of the areas that are affected by these encampments, and with some of the groups that are working with people experiencing homelessness, and indeed with the residents themselves. And I can just tell you that the city's position is consistent and is maintained, which is that these encampments in public parks are not healthy, they're not safe, and they're not legal. And what we're now concentrating on doing is finding alternate housing and shelter for the people who are resident in those encampments. Then we are going to take steps to take out some of the many tents and other structures that are actually not occupied at the moment. But that is something that is our responsibility to do. But we're doing it in that way in Toronto that uses a combination of compassion and resolve to get something accomplished as opposed to any other approach we might take.
That's it, thanks.
Okay, Samantha, thank you, everybody. That concludes today's briefing. As the city's Chief Communications Officer, I too would like to thank Vaccine Hunters Canada for their positive and civic-minded approach to communicating vaccine opportunities across the country. Thank you, folks, for all that you're doing. Thank you, everybody. Please stay well.